Breast cancer in men.
Cancer is the leading killer disease all over the world. There are different types of cancers that are identified with the areas they attack. Breast cancer in men is not as common in the medicine fraternity as it is in women. This is because of the fact that breast tissues in men are less as compared to those in women. Therefore, cases of breast cancer in men are not as widespread as they are in women. The breast tissues in men are similar to those in young girls just before they enter the puberty period. As such, breast cancer in men is triggered by the breast tissues in men. However, the breast tissues in men do not develop as those in women, and that's the reason why in most cases cancer cases in the breasts of men are less common. Despite the lack of growth of men's breast tissues, breast cancer in men is similar to that in ladies and occurs in similar ways as that in women. Even so, cancers that involve milk production and storing tissues in the breasts of the men are quite rare. A medical research conducted in the USA in 2012 has shown that an estimated figure of 2,190 breast cancer in men have been diagnosed in the first quarter only. Which class of men is more prone to get breast cancer? Breast cancer in men is quite rare for men who are below 35 years of age. In most instances, it has been referred to as a disease of the old mainly because it attacks men who are over 35 years. The probability of breast cancer in men increases in respect to age. Most of the breast cancer cases in men are diagnosed at around 60 to 70 years of age. This is the stage at which the man's body immunity is usually very weak. Therefore, the cancerous cells in the breasts of men grow at a very high rate due to weak body resistance. There are other risk factors for breast cancer in men. These factors include the history of breast cancer in men in a specific family lineage. In a family where the disease is present within their lineage, men in the lineage are more prone to getting breast cancer. TTHE history of the exposure of radioactive rays in the chests of men. TTHE existence of a medical condition that brings about an abnormal breast enlargement, gynecomastia, can be a possible cause of breast cancer in men. The enlargement usually comes about as a side effect to different infections and hormone treatments. Genetic mutation in a specific family line can also be a possible cause of breast cancer cases in men. The mutation is best known as Klinefelter syndrome in the medical fraternity. Cases of severe lung diseases and testicle diseases such as mumps or Krebs that results as a result of testicular injuries or as a result of deformity in testicle development. The seriousness of breast cancer in men for a long time now, doctors and other players in the medical fraternity have been downplaying the severity of breast cancer in men. However, as of now, the disease's severity seems to be almost equal to breast cancer in men. Most of the symptoms and effects of the different breast cancer cases are similar both in men and in women. The biggest hurdle in breast cancer in men is that in most cases, the disease is usually identified in its late stages. This is due to the reason that the level of likelihood of breast cancer type in men is lower than in women. What's more is that there is a very small amount of breast tissue in men which is usually very hard to feel. Due to the late diagnosis of breast cancer in men, tumors in the cancerous tissues and cells in men's breasts spreads at a very high rate. Symptoms of breast cancer in men. Symptoms of breast cancer in men are quite similar to those in women. In most cases, the existence of breast cancer in men is usually diagnosed after the formation of a lump in the man's body. However, the symptoms of breast cancer in men are more widespread than they are in women. In most cases, men usually experience continuous bleeding from the nipples. In addition to the bleeding, there is usually a skin deformation in the area around which there has been an attack of cancerous cells in the breasts. At such a time, there is a very high likelihood that the cancerous infections are usually spread to other regions such as the lymph nodes. This is usually an advanced stage of breast cancer in men. Breast cancer in men. Diagnosis and treatment. There is a very high similarity between the diagnosis steps of breast cancer in men and in women alike. Diagnosis mainly involves various steps and strategies such as physical exams, biopsies and mammography. The examination of the cancerous cells in the breasts is usually done by screening in microscopes, both light and electric microscopes. Upon the diagnosis of cancerous cells in men's breasts, the patient is immediately put under medication. Treating the disease in its early stages increases the chances of possible cure and treatment. In the advanced stages of the disease, treatment is usually very hard to achieve. As such, medics campaign for early screening and diagnosis of breast cancer in men. Treatment options used in treating this type of cancer are similar to those used in the treatment of breast cancer in women. The greatest difference in the treatment of men's breast cancer and women's breast cancer is that in the former hormones are more responsive to treatment than in women. Treatment options used in treating breast cancer in men include radiations, surgery, endocrine therapy and chemotherapy. The choice of either treatment option is dependent on a number of factors such as the stage of the disease. Advanced breast cancer stages in men require advanced treatment options such as surgery. In other instances where the disease is not so widespread, separate treatment options such as radiation and therapies are used. In conclusion, men should undergo regular checkups in order to establish the existence of the cancerous cells in their breasts.